Definitely we love our kids but know what they do to our bodies. But luckily, with the combination of technology, science, and the artistic sense of one of the most prestigious plastic surgeons in Houston, through the procedure called Mommy Makeover, we can bring our confidence, our body back in shape. I'm Andrea Gomez, and I want to invite you to join me to the Mommy Makeover reality show by Dr. Newall and one of his patients.
I'm Dr. Newall, a plastic surgeon. My specialty is mommy makeovers.
My name is Susan Hage, and I just turned 40. So I think it was about due time to do something for myself.
Ready? I'm gonna meet you.
I'm a mother of 3. I have a 14-year-old, a 12-year-old, and an almost 4-year-old. And being a mom is one of the biggest accomplishments I think that I've had.
Okay, so my morning routine is really down to like 3 things now because it's grab the sweatpants, grab the sweat, workout clothes and get out of here that I just don't feel comfortable in anymore.
So the combination of having children, of turning 40, hormones, what have you, everything I think has taken a toll.
The sad part is I could wear most of this stuff. Of course, I would come out and whatever, but now it's like...
What about the baby suits?
Oh God, don't even go there. That's depressing. So let's see.
Even with the weight loss, things just don't go back to where they are. And I've seen amazing results from all of Dr. Newall's patients that I've spoken with, and especially after doing my research and talking to people who I didn't even know had surgery done, they all come back to the same name, and it's always been Dr. Newall, Dr. Newall, he's the best, go talk to him. So this is where my journey begins, and I'm very excited, a bit scared, but very excited to see where this is gonna take me.
Let's see what Puppy wants. Okay, seriously, the surgery's in like 3 days and now you're telling me that? What do you mean I shouldn't do it? Why? Why not? It's because this is only between me and you. It's happening. I'm doing this and I don't know what to tell you. I don't know. Yeah, actually I did. I paid yesterday. I did. Why don't we talk about this later when you get home, because this is ridiculous, okay? I love you so much. I don't want to fight about something like this now. I've got plenty of other things to worry about. Seriously? Seriously? 3 days before? Seriously?
Most husbands I dealt with, afterwards, after the surgery's over and they see the results, they say, this is the best investment I ever made.
Emphasis on the name of the procedure, Mommy Makeover, I think it helped my children, or my daughters at least, understand why mommy is ready for something like this and why it's okay for me to be able to do this now. And they've seen my struggle, they've seen me work out, they see how I eat, they see my lifestyle, and that's been able to justify.
A mommy makeover makes you competitive again and restores that body that you had pre-baby era. So it's the right thing to do, and not only makes you look physically better, but mentally you're just 10 times better.
No more grandma bras.
Susan, hi.
Yes,
How
hi.
are you?
We're good. How are you?
Good to see you. I'm Dr. Newall.
Thank you.
I would probably recommend a tummy tuck.
In her case, we're going to do everything that a mommy makeover is all about. It's improving her abdominal wall, sizing that excess skin that she has, contouring her with liposuction, enhancing her buttocks with the fat that I'm getting from her liposuction rather than throw it away, and of course, lifting her breasts that were both deflated and a little droopy.
I have these memorized online. I've been stalking you. I want that.
Okay.
I want that.
So I think that the hopes of accomplishing what I want, which isn't just weight loss of, being super skinny, but just basically putting things back where they belong, getting rid of the extra skin that's formed.
This is elective surgery, and you have to choose right. You make sure there's a board-certified plastic surgeon that does it every day, and you feel comfortable with them. I'm not saying that complications never occur. Of course they will occur, but then you have the surgeon to fix them and to make sure that everything is safe.
So this just happened. We're all signed up and we're ready to go. We're doing this on Monday. I'm so excited.
Surgery day.
Excited, dying, nervous. I didn't sleep. I'm like dying. So excited though. We're here. We're at the surgery center. I hope Dr. Newall had a good night's sleep because I didn't.
said I'm ready?
No. Are you ready?
Of course
Did you
I am.
sleep well?
Very well.
Okay. Now I feel good. A lot of marks.
The marks that I make is so that I can get oriented while she is laying in bed and I lose part of my orientation. So this way it makes me know exactly what I'm going to do. Yeah, that's it. We got it. You're going to meet your anesthesiologist. He'll start an IV, give you a little medication.
Showtime. Wish me luck. See y'all. She's gonna do great.
The surgery's going to take about 4 hours. She's going to be in the recovery room for another hour or so before she can go home. I will send a nurse to see her tomorrow at home to make sure that she's doing fine, and then I'll see her in 6 days to take some of the stitches out.
So this is a tumescent solution that consists of saline with epinephrine, and I'm going to go to the other side. Now we're going to start the liposuction of this area. It's very atraumatic in the sense that there's minimal blood loss. We got about 250 cc's of fat. Again, when injecting that tumescent solution, just to give me different routes to really maximize the curvatures.
We always make a medication timetable, and that kind of helps because it is a lot of medication, so it kind of helps keep everything organized. I'm able to straighten out a lot better than when I first started. It's mostly tenderness and soreness, but as for pain, it's very controllable with the meds. I mean, I'm already up and walking, and I can use the restroom on my own, which is amazing. It's definitely something you can't do alone, but worth it.
My name is Liz. I'm going to be doing the dressing change for Suzanne. Basically just putting clean, fresh pads over all the incisions, taking a look at everything, doing an assessment, and make sure that everything's healing well and reassuring the patient of that.
First day out of the house since surgery. It's been a week and a day, and I'm counting. Hopefully we get this drain out today and look a million times better. Yeah?
So it's been 1 week.
1 week.
You're looking great. You're looking really, really good. Everything looks awesome. I want to see you next week, make sure everything's all right.
Okay.
And then after that, it's going to be better and better and better.
Okay, and the stitches and all that? will just-
Those are absorbable stitches, so you don't have to worry.
Okay.
Everything else is just absorbable. In terms of fat, as I recall, it's probably about 7 to 8 pounds of fat, which for the trunk is remarkable. Extra skin, is probably another 4 or 5 pounds.
Wow.
And that also works with the breast. Now, the scale is not going to show all of that because number one, there's still swelling. Number two, I put some of that fat in her buttocks and trochanter, so it's a redistribution basically. But it's going to be a remarkable change.
2 weeks and 1 day post-surgery, and we're off to see the doctor. I have my jeans on. Probably the second time I try to wear them. Not gonna lie, it was hard to get in them right here to buckle, and it freaked me out. I was very scared because of all the swelling. It still hasn't gone down. I'm being told to be patient. Patience is really hard to come by these days because you want instant results, but big difference. I have the hottest waist ever.
Well, you're doing great in your healing process. You're ahead of most.
Okay, so I shouldn't worry about like popping a stitch
No.
or something whitening?
No,
or-
it's not gonna.
I hear horror stories.
No, nothing.
So I'm good.
You're good. I anticipate that in 2 months she's going to look really, really good.
So it's been 9 months
since we did the tummy tuck and liposuction in Susan. Everything is healing beautifully. She still has a little bit of darkening on some of the scars, which we will treat with bleaching creams. Shape-wise, she looks fabulous.
I'm extremely pleased with the results. I've had this dress in my closet for about 3 years. 3 years ago, I thought I could wear it, and every time I put it on, I'd take it off because I would bulge from here, and it just was not a nice shape. And here I am today wearing it to a doctor's appointment. It's out and do whatever you need to do. So it's been awesome, amazing. I recommend it.